It's Ryann and Jen back again with our FIBBcast, the reasons why you should FIBB. And today we're going to discuss a huge topic on bioidentical hormone replacement for both men and women. If you suffer from low energy, low libido, hot flashes, all the good information that we're going to tell you about today, and really an educational piece on how hormones work, etc. So
make sure to subscribe, like, and share us. And as far as BioTE, bioidentical hormones, it's a huge thing. We use BioTE here, but it's hormone replacement. So tell us a little bit about that, Ryann.
Yeah, so a little bit background. When I was 37, the reason why I brought it in, I was suffering. I was a mom working, 2 jobs and suffering from low energy. And my main symptom was night sweats. And I did not know what was wrong with me. I thought I was too young for hormone replacement. And a physician friend of mine said, let's draw your labs. And so after receiving my lab values back, I didn't understand why I had those symptoms. And sure enough, I had low testosterone. And we'll get into that a little bit more for women. But that's kind of how I brought it into the practice. And BioTE is actually one of the providers that supplies our bioidentical hormone replacement. Why do we choose BioTE? They're phenomenal. Dr. Donovitz is world-renowned researcher, cardiologist who actually started BioTE. BioTE's been around since bioidentical hormone replacement, and the pellets have been around since the 1930s. Imagine that.
Wow.
So, in the 30s, it was a big deal, hormone replacement, and then the synthetic hormones came out, which we'll get into. And so bioidentical kind of went into Europe in the 1950s, and within 1980 to 2000s, the pellets came back to the U.S. because people were really craving procedure and that hormone replacement therapy that could be life-changing for them. And that's what we're seeing with a lot of our patients.
Absolutely. So kind of how does that hormone replacement therapy work?
BioTE offers pellets, and there's multi-modalities and ways that you can do hormone replacement. We offer bioidentical hormone replacements through BioTE in the pellet form. With BioTE, there's a little pellet actually that goes into both men and women, and they're about the size of rice pellets. And we'll kind of jump into why the pellet's better than the injectables and the creams. The pellet actually is a little incision, and it goes into the subcutaneous tissue or the fat tissue into, usually the upper glute, or you can do the flank. And the pharmacokinetics, pharmacodynamics, which is a big word, but it is a medical understanding on why shots and why creams are different. So the pellet form actually, when we insert it, gives you a steady state. There's so many benefits to that versus the injectables are, it's a 2 a week shots. And so there's this, the ups and downs and the roller coaster that patients experience with the shots and the creams.
Right.
As far as with the creams, our skin is an organ, and it's made to keep these things out. Have you ever done creams?
No, I have not.
A lot of our patients have, and we educate them on why.
Yes.
And we do hear, this symptom's resolved, but I'm not really feeling better. Well, our patients with pellets say it's life-changing.
Correct.
They have a steady state, and like I said, when you exercise, it's called cardiac output. The pellet dissolves at a steady state. And so that's really where the benefit is of that modality. And also there's something called erythrocytosis. That's a big word, but you hear, especially men who do the injections, their red blood cell count, gets higher. So they have to go and give blood or phlebotomize, we call it. With bioidentical, you do not have to do that, typically. Your blood levels maintain. And, of course, you're doing it twice a year for men. Women are every 3 to 4 months, and so there's a steady state of release, and there's a balance, and patients feel that.
So you talk about injections, creams. Why are the pellets? So those are some of the reasons why the pellets are better than those type of hormone replacement. Less times that you have to do it a day as opposed to. So can you break down a little bit maybe what the benefits are as opposed to why do they want to choose the pellets over the injections or creams? Because maybe some people can get those things less expensive, and maybe why they should go the pellet route as opposed to one of those.
Yeah, we've had patients both men and women that do injections, and some of the women are doing their husband's dose, and it's just regulatory. Like, they don't understand it. And we also have patients that travel, and so they're taking these injections with them. Then they have to go get their blood checked, every 3 to 4 weeks. Plus, they have to donate blood. It's just a lot. Where pellets, they come in. They have the little incision. It feels a little bit like a golf ball because we are doing more pellets. But as they dissolve over time, it's a come in and then you don't think about it. And that's where the benefits are. And then we have women who do the creams and they're like, well, my husband, it rubs off on my dog, my husband.
Right.
And again, your skin is an organ. And so they don't get therapeutic. We talk about peaks and troughs. And again, that's a big medical word. But we draw labs after the pellets to see where their peak is and really, optimizing them. Do they feel good? And so that's a little bit of, educational piece on why we use pellets. And I firmly believe that pellets are the best way to have hormone balance.
So take us through the process. I mean, I kind of know the process. I do pellets. But take us through the process of a patient of coming in and what the process is here at FIBB Botox Bar and what we do for them as far as that goes.
Well, first and foremost, we have nurse practitioners and physician assistants that have practiced internal medicine, surgical, PAs. They are very well educated on every, symptomatology, comorbidities, high cholesterol, high blood pressure, strokes. I mean, our staff is highly, highly competent and knowledgeable. So that's first and foremost. I'm a nurse anesthetist by trade. So we've been around really sick patients, and we see the benefits of this with preventative medicine. And so pre-screening, we have a full process here. When patients call, we are very much, standard of care, and we require lab values. We do annual labs. We also do pre-screening for mammograms and also PSAs. We are very into pre-screening, making sure patients do their colonoscopy, bone density, which is another fun topic we'll talk about. But and some of these patients are 50 and they've never had their physicians have never mentioned bone density. So when they come in, we do labs on site, which is so convenient for people. If you have insurance, we also will send patients to get their labs drawn if they, don't want to pay out of pocket. Which bioidentical hormones are not covered by insurance anywhere, unfortunately.
Right.
And it's a 2-day to 2 weeks within labs. So our medical assistants draw labs here on site.
Yeah. Well, it's nice, too, because then they've got a background of what's going on. You've got a background. They come in. It's maybe a 30-minute procedure. Like you said, small, like rice-size pellet, a little incision into one of their butt cheeks. You kind of patch them up, and what as far as what some of the things that maybe they can't do that day, the next day, like what does that downtime look like?
So yeah, let's jump into that. So the procedure itself takes 15 minutes. And once they've been pre-screened, we've gone over their full consultation and kind of a plan. We do explain the whole process to them. And so they come in and we usually alternate. So like I said earlier, it goes into the any fat, in the upper glute area or the flank. And they come in, we usually start on the right side, and we do alternate every other treatment, either side. And so they come in, it's a little bit of numbing. Like, again, that rice pellet's really small. It's not, it's not an implant, really, but it dissolves over time. So it's not something that people should be afraid of. And then, they leave. It's 3 days, no submerging in water. We tell them no bath, no hot tubs. Just to be careful with working out.
Yeah.
So, as far as the downtime, there's not a lot.
Right. And like you said, with pellets over some of the other things, like, maybe insurance doesn't cover the pellets, where that would cover the shots or creams or things like that. But, it's definitely worth it. I'm going to speak a little on experience because as far as who's a candidate for it, well, I was a candidate for it, you know.
So tell us about your symptoms.
So, I mean, they were kind of all over the place. It was like, am I crazy? And is something wrong with me? But obviously you start aging and, do the blood work. And, there's some things saying, women and testosterone. And should we have all this testosterone? And it's definitely.
And I gave her this book to read.
Yes, absolutely.
Testosterone in women.
So I was having like some anxiety and some, low libido. And of course, sleeping at night, I was, sweating. And it was just like, this thing of like, what's going on here? So got the pellets, super easy procedure. And I like the fact of it's done, right? So for me, it's every 4 months. I'm not putting a cream on. I'm not doing a shot. I can kind of forget about it. It's not those peaks and valleys. It's a steady flow. I kind of read a little bit about it too. And so it was kind of mindless, right? It's a mindless thing. But I do know that, as it gets close to my 4 months, it's about time, right? So usually after about 3 weeks, I notice I'm like, the energy's there, the libido's there, the hot sweats are gone. I used to go into restaurants and was like freezing all the time. Everything is just kind of, and I know symptoms will be different for everybody. Not everybody's going to have the same symptoms that disappear, and some people might have different symptoms. But out of 7 of those symptoms, if 5 of them are gone, I'm a happy camper.
Yeah. And as a provider, Jen came to me, she was struggling with anxiety. She fell off, and that's kind of the same thing we hear from all patients. They don't know what's wrong with them. Especially the energy, they want to have a cup of coffee. They're like, why do I feel like I can go to sleep, at 2:00 in the afternoon? But one thing, going back to what you said, we are running ourselves, burning candles at both ends. Everybody is. That's just our lifestyle. And so we just try to push through, and you don't have to push through. And that's the thing with educating physicians, primary care, GYNs, to talk about hormone replacement. She was suffering from anxiety. And so many patients, me too, I was getting palpitations. And so when you're looking at what's happening with us after we've had kids and we're, kind of that burning candle at both ends, your anxiety got so much better. Mm-hmm. And we hear that. People are like, it is a game changer. It changed my life. I feel balanced.
Right.
And that's what it's about.
Well, it was that whole brain fog and not knowing of, again, where am I going with it? I could have done the creams. I could have done the injections. You look at weigh all those pros and cons kind of thing and what's going to be better for me. But again, like I said, if you have 7 of these different symptoms, if 5 of them it's helped, that's great, you know? And again, it's simple, these are pellets from what I know and have read that, they're more of a natural, made up of natural product. I think it's yams and soy or something like that. So, I didn't feel like it was something, that was so much of a foreign, and I've been doing pellets now for probably 3 or 4 years,
Yeah. And that's the thing, the whole, her fiance is also on them. So we do say, and people have come in with their, first the wives do it and then the men come in and they're like, we test their testosterone and it's in the tank. So they get pelleted. It saves their marriage. We have heard that, save relationships. I just had a patient the other day, who was telling me her story. She'd been divorced. She didn't know, this was 15 years ago. She didn't know what was wrong with her. Her doctors told her she didn't need hormone replacement. She was fine. And, she started doing this 4 years ago. And she said to me, I wish I would have done this. It would have saved my marriage. And so that is a big thing too. But let's jump into the benefits. So brain, breast, bone protective. And this is real data. I tell patients, we have thousands of studies on bioidentical hormone replacement versus synthetic. And that's where I love BioTE. They're really invested in brain health, all of the symptoms and also the research. So breast, brain, bone protective, we tell patients.
Right.
So decreased risk of Alzheimer's. Men, especially, who have a risk of cardiovascular disease, family history, there's actually a decrease in men with a study that they've done. They've done a twin study. There's patients that have actually, and I've seen it clinically, reversed their osteoporosis. So we talk about DEXA scans with patients, and they have, osteopenia, which is, the beginning of bone disease. I had a patient, she is an eye doctor in town. She reversed her osteoporosis in 4 years.
Wow.
And she was in her late 40s.
Wow.
So just these benefits, again, the Alzheimer's, the brain function, and you said that, the brain fog.
Right.
People are like, I can concentrate again. ADHD, I feel like people can get more focused.
Right. Again, it's like all those different symptoms. Like for guys, the whole testosterone thing and their workouts are better and, for women too, but all the different things that you think of is something wrong, and a lot of people want to resort to I'm going to take a pill for this or a pill for that. Once you get the blood work done and you see where you need to be and then the benefits of it as well, not just how you're feeling, but like you say, with the breast, with the bone, with, all the different.
And testosterone is actually breast cancer protective. So we have a lot of patients we educate, there's so many things out there saying, hormones cause cancer and this and that. Yes, with the synthetic, and there was a Women's Initiative study that did say that they've actually reversed that. So bioidenticals, our endocrine system releases it. And so even women in their 20s start losing testosterone. And that's where I say testosterone, even for women, if you can get one thing out of this, I will say peri, so, 30s, into perimenopause, testosterone can basically relieve 85% of women's symptoms. Energy levels, sleeping problems, night sweats, hot flash. That's the most common thing, but people don't realize the energy, the workouts. My workouts are so much better.
Yeah.
Muscle mass. Let's talk about that in women.
Yeah, absolutely.
So you work out a lot. So do I, 5-6 days a week.
Right.
Can't we tell a difference in the gym?
Absolutely. Yeah. And like I said before, when you start how you start feeling. It takes a little bit. I think it took me a couple rounds of the pellets for it to really start kicking in and knowing kind of this is, where I'm peaking and this is okay, it's time. But the workouts, the muscle, building those things, and it's helped drastically.
And I tell patients that, if they come in, so they get pelleted, we draw labs 4 to 6 weeks later to see where they're at. And, as far as with the symptoms, we see where their symptoms are relieved. And I tell patients each week you're going to notice certain symptoms that resolve. But the key is to do this for a full year to really see. And even that, if they say, oh, I don't know, I'm not sure that it's better. One thing I do notice that people say, I'm dreaming. And I say, well, that is one of the first things that people will notice. They're getting that REM sleep, so they're getting better sleep. But if they discontinue it, like you said, back to what, 3.5 months in, you're like, why am I, fatigue again, the energy, the workouts get,
starting to lag.
Yeah.
Well, and here at Face of Botox Bar, again, it's you guys are looking at the blood work. It's a systems. You're rechecking them. There's some places I've had friends that do it, and they're like, well, I didn't have to have that done, or I didn't have that done. And, that kind of throws a flag to me, like, well, why aren't they checking that? And why aren't they seeing before they repellet you where your level's at, what you need, what you don't? Some need estradiol. Tell us a little bit about how that works in with that.
And that's the key. That's why we're different. We are full comprehensive. We keep a close eye on patients, and, that, makes us different than others because we are that way. But yeah, so the pellets, actually, you can get testosterone pellets, you can get estradiol pellets. Progesterone does not come in a pellet form for various reasons, but medically, basically, orally is intake at night is better for progesterone. Mm-hmm. So that's, a full, let's talk about women. So pre-peri, they only need testosterone replacement. And usually, in women, we see them usually 7, I think I was 11 to 20. And that's, if you're taking for lab values, just to explain this, if you're taking a cohort or a group of people of 1,000 people and they draw their blood levels, that's how these labs come up with, what's normal. And so a normal lab value for testosterone for women, BioTE method, and I stress this, the BioTE method, lots of research behind this, is 150 to 250. And in men, we target, we see a lot in the 300s, 200s. I've had a 30-year-old that had a testosterone level of 200. And so BioTE method is 900 to 1100, and that's where we try to optimize these patients. But again, why are these men only seeing, 200s? Again, it's that stressful life, our cortisol level. There's a lot of labs that we draw to try and get to the bottom of why these patients, have low testosterone.
Right. So, if they are low on estrogen, you're able to give them, put that in with their pellets. You can get them on the progesterone. We also here have the different nutraceuticals. How are those kind of play a part?
Yeah, so let's talk about that. With the lab values, again, vitamin D, we really stress that for immunity and bone health. So we do ADK10. Let's talk about DIM. So, when we're doing these hormone replacement on people, we want to make sure testosterone stays good testosterone. So DIM is a hormone balancer. Okay, and we really keep patients on this. So they take 1 a day. Men usually take 2 to 3 to make sure their testosterone does not convert into estrogen. And that can happen. It's called aromatization. A lot of men that do the shots, they have to take estrogen blocker called anastrozole. Right. We actually can pellet with anastrozole. It comes in pellet form too. Mm-hmm. So our nutraceuticals, again, balancing. I take methyl factors, ADK, DIM.
Yep.
You take these
Omegas,
too.
Yep.
We have deep sleep. We have probiotics that, again, come with the BioTE. And so it's a full balance package.
It does. It kind of helps to have those extra things maybe that you are lacking if you need something in. There's 4 or 5 of them that I take. And then on top of those, you guys also offer some of the peptides.
Yes, peptide therapy,
That's
again,
a
a huge topic. What are peptides? There's so many peptides. BPC 157 for inflammation. I had surgery. My son's had surgery. I have a friend that just had an injury. I have him on it. It helps with inflammation, decrease inflammation in the body. The other big one is Samorelin and CJC ipamorelin. Those are what's called your pituitary secretes growth hormone at night. People know growth hormone. It is not growth hormone replacement. It actually gets your pituitary at night to secrete more growth hormone. Metabolism booster, muscle builder, that's a huge one. So we package that. And that's the thing, BioTE will help you lose weight because it changes your body composition, more muscle mass, less fat. And BioTE, the other good thing to know is that testosterone actually helps against insulin resistance. That's a huge thing. We see a lot of metabolic syndrome. People are gaining weight. They don't know, what's going on. So again, pellets and testosterone replacement alone is amazing.
No, it's definitely, obviously being here, I hear all the stories of patients and they're coming in and how they're feeling. You hear them talking about it. No one's super quiet about it anymore. I think at one point that, no one really talked about, I have low libido, or no one wants to say, I have this, I have that. You feel it's, again, part of just how things are supposed to be. And when you get on something like that of the pellets and the hormone replacement therapy, you're like, all right, well,
And we are welcoming. We're here to talk about it. I'm seeing patients for Botox or filler or laser, and we sit and have conversations about this stuff. And people are really struggling because I think there's just been this stigma about hormone replacement causes cancer. Oh, my doctor told me I can't do that. We'll sit and have a conversation with you. I can print, thousands of studies, and, we let patients make their own decisions, but we do educate. And I just think that it is becoming more of a discussion amongst women and men, and what are we doing? Anti-aging, he looks better. Why is he 60 and he looks 40? Right. It's, and I have a patient who's been doing hormone replacement for 25 years. She's almost 70. She looks like she's in her 50s. So that, again, there's just so many benefits. So come and have a conversation. We do a full comprehensive, consultation with you. And, we give you books to read. We give you the data to help you make decisions. And we really encourage patients to seek and just a better quality of life. And, why not? We're aging, we're living longer. Why not feel better?
Absolutely. No, I'm the hormone thing is like you say, been a game changer. It's helped me. It's helped you. We hear the stories. There's
all of our staff's on it.
Yeah. There's a lot of information and stuff like that. Do your research. Come in and talk to us. We've got plenty of people that can talk to you about it. If it's, getting yourself kind of balanced. And again, the pellets for me are much easier to deal with than the shots and the creams and all those kind of things that they offer. So if you want some more information, you can reach us at www.faceabotoxbar.com. You can call 239-322-3815. Make sure to subscribe, like, and share. Do you fib?
I fib.
You should fib.